Pregnancy comes with a lot of joy, but it also comes with a lot of changes in the female body, including in the mouth. Make sure a regular routine of your teeth cleaning, which is brushing twice a day. Try and use the mouthwashes that has some medication of the gum treatment. Instead of using a normal floss, try and use a water floss. Pregnancy comes with a lot of joy, but it also comes with a lot of changes in the female body, including in the mouth. The first common change that we see is an increased sensitivity, and what we also say as an increased chipping of enamel during pregnancy. If the female is going through lots of phases of nausea or morning sickness or vomiting episodes, we see that changes the pH level of the saliva and our outer layer of enamel becomes weaker because of that acid attack. Try and use a xylitol-based chewing gum or a xylitol-based mint after that episode of nausea or vomiting. Visiting to your dentist if the sensitivity is very high, and if you feel that sensitivity is increasing with time, it's always important to speak to your dentist about that because there could be some formation of cavities that we have to deal with. Make sure you do not brush your teeth right after the episode of vomiting or nausea because we have this urge of getting rid of that bad taste from the mouth and we really tend to brush really hard. Then try and leave a gap of half an hour. I totally understand that you want to get rid of that taste from your mouth, so try and rinse your mouth with plain water or with some mouthwash, but try not to indulge into aggressive brushing right after because already because of that acid attack, your outer layer of enamel is weak, and if you try and brush really hard after that, you take away that layer of enamel, which can lead to further more chipping of enamel and increase the level of sensitivity. And we all know once we start losing enamel, it is something which is very irreversible. So just dealing with it with a bit of a smart move will really help us in making sure we keep our enamel healthy and strengthy. To make sure a regular routine of your teeth cleaning, which is brushing twice a day, try and use the mouthwashes that has some medication of the gum treatments, and making sure instead of using a normal floss, because the flossing becomes very hard with the enlarged gums, try and use a water floss. Let me give you 5 tips to look after your teeth while you're pregnant. Number 1, if you have episodes of nausea, morning sickness, or vomiting, do not brush your teeth right after. Leave a gap of half an hour. Use a xylitol-based chewing gum or mint to combat the bad taste that's in the mouth because that really helps in making your enamel stronger. If your gums bleed and if your gums are sore, brush your teeth twice a day with a soft bristle brush, but also use a water floss because here the water floss will go underneath the enlarged gum surfaces and helps in making your teeth and gums clean better. Number 3, visit your hygienist at least 3 times during the 9 months time because your gums and your teeth require more cleaning and care. Number 4, use a fluoridated toothpaste if your teeth are sensitive because that really helps in making sure that your outer layer of enamel gets strengthened. 5 is make sure you follow a good and a healthy diet because our saliva is changing, the body is changing, so we must emphasize on the use of the healthy sugar rather than having the processed sugar.